Well, thank you, Sue. I just want to say thank you so much for the invitation. It's not every day I get to speak to people about prediabetes, and it is something I'm very passionate about. And as Sue mentioned, I do take care of both kids and adults with diabetes, so really from birth to death. So I have a lot of experience caring for different patients at different times and different types of diabetes. But today we're going to be focusing a little bit on type 2 diabetes, but mostly on prevention and prediabetes. I have no disclosures today. So first we'll talk a little bit about what does prediabetes mean and when do you reach the threshold of type 2 diabetes? Who is at risk for prediabetes and type 2 diabetes? What are the risk factors that we should know about? And then what are the lifestyle interventions that we can do to manage prediabetes and reduce the risk of developing type 2 diabetes? So some patients ask me, what is diabetes anyway? And it's really a condition where your blood sugar or your blood glucose levels are too high. They're above normal. And over time, having high levels of glucose in your bloodstream can cause health problems. The most common health problems that we see is that the high glucose can damage your eyes, the back of your eyes. It can damage your kidneys and the nerves, more so the nerves in your feet. Diabetes is actually the leading cause of preventable blindness in the United States, the leading cause of end-stage renal disease requiring dialysis, and one of the leading causes of amputations. Many of you are probably aware there is a strong link between type 2 diabetes and heart disease, stroke, and poor circulation. Diabetes is the 7th leading cause of death in the United States today. So this is information from the CDC from 2017, and right now there's about 35 million Americans that have diabetes. That's about 1 in every 10 adults. Not everyone knows it, however. In early diabetes, the symptoms can be mild or you may have no symptoms. So about 1 in 5 of those individuals don't even know they have diabetes. You'll notice this bigger number, 88 million people, have prediabetes, which is the precursor to type 2 diabetes. So there's a much larger number of patients that have prediabetes. And our hope really is to intervene in this population to help them reduce their risk of developing type 2 diabetes. We have found that most people, 8 out of 10 Americans that have prediabetes, don't even know it. There are usually no symptoms, and so unless their physician is screening them periodically, they may not know they have prediabetes. If you can intervene at the stage of prediabetes and you can make some changes in your diet, make some changes in your activity level, you can reduce your risk of developing type 2 diabetes by 50%, cut that risk in half. So when we talk about diabetes, there's 2 main types of diabetes. Type 1 diabetes is the autoimmune form of diabetes, where your immune system really destroys the cells in your pancreas that make insulin. So your immune system destroys the cells that make insulin, so you no longer make any insulin. And so all patients require insulin from diagnosis. This comprises about 5, 6, 7% of all patients with diabetes, so it's a minor form. Type 2 diabetes is the more common form. Roughly 95% of all patients with diabetes have type 2. And you generally make insulin, but you don't respond to the insulin. We call that insulin resistance. Early stages of type 2 diabetes can be treated with diet and exercise, but most adult patients eventually need medications. Oral medications can be used early on in many patients, but ultimately many patients require insulin. So Massachusetts monitors the state of diabetes in the state, and public health data has suggested that about 13% of Springfield residents have diabetes. So in the US, about 10% of patients have diabetes. In Springfield, it's a little bit higher, it's about 13%. So that averages out to about 20,000 people with diabetes in Springfield. Baystate Health cares for 18,000 patients with diabetes, so we do care for a large population. But if you extend that to the greater Springfield area and include the surrounding towns, there are about 70,000 people in the greater Springfield area with diabetes. Now, this is a common slide that's shown when we talk about diabetes because this is just the tip of the iceberg. These are the patients that we know about that have seen their physician, that got diagnosed, so we know they have type 2 diabetes. But there is a much larger population below the surface here with prediabetes, that 86 million. And only 11% of people actually know they have prediabetes. So our goal is really to try and find these people, identify them early, and prevent them from developing type 2 diabetes. With the rise in obesity in the United States, we are seeing rising rates of diabetes, and current projections are that diabetes rates are expected to double by 2030. And without lifestyle interventions, 15 to 30% of people will develop diabetes within 5 years if they have already met criteria for prediabetes. That's without lifestyle interventions. So if we can intervene with lifestyle interventions, we hope to lower the number of people that will develop type 2 diabetes. So in Massachusetts, approximately 35% of the population have prediabetes. And in Massachusetts, studies have shown that only 7% of patients that have prediabetes even are aware of it. When you look at the population over age 65, this number jumps up to 50%. And so some studies have shown that 50% of patients over the age of 65 have prediabetes, and most don't know it. We know that there's a period of time where you have prediabetes before you develop full-blown diabetes. That period of time varies amongst individuals, and there's a lot of factors that contribute. We define prediabetes based on certain criteria. Basically, an abnormal fasting glucose or abnormal glucose tolerance test that really has not reached the threshold for type 2 diabetes yet. And we'll go over what those numbers are in a minute. Without intervention, there's a 70% lifetime risk that you will move from prediabetes into the type 2 diabetes category. So the lifetime risk for developing type 2 diabetes is very high. So I know this is somewhat of a busy slide, but I'd like you to focus here at this time 0. This is when you're diagnosed with type 2 diabetes, time 0. Because there is quite a bit of time, 5 to 10 years, before the diagnosis of type 2 diabetes, where there are abnormalities that can be detected and acted upon. So we know that prediabetes goes on for several years prior to the development of type 2 diabetes in most individuals. We also know that you can develop complications from high blood sugars even before your diagnosis of type 2 diabetes. So microvascular complications, those are the things that I mentioned before, like damage to the eyes, damage to the kidneys, and damage to the nerves. And so those complications can happen even before the diagnosis of diabetes, after you've had prediabetes for a few years. Macrovascular complications are things like heart attacks, strokes, and poor circulation. Those can occur even before the diagnosis of type 2 diabetes and once you've developed prediabetes. And what we see is that very early on, even 10 years prior to diagnosis, the glucose levels are rising above normal. So the fasting glucose is rising, the postprandial glucose, which means the after meal glucose, has started rising. And there is worsening insulin resistance for many years. So our goal, if possible, would be to focus on this group before the development of the type 2. So who is at risk for diabetes and prediabetes? Well, being overweight really is the #1 risk factor, but there are a few others. Having a first-degree family member with diabetes, being over the age of 45, having high blood pressure, leading a sedentary lifestyle. Women who have had a prior history of gestational diabetes, which means high sugar levels during a pregnancy, or polycystic ovary syndrome, are at risk. And then certain ethnicities have a higher risk of diabetes and prediabetes. The 4 highest risk ethnicities would be African American, American Indian, Hispanic, and then Asian American or Pacific Islanders. So the American Diabetes Association has a risk calculator as to trying to identify who's at risk for diabetes. And so I'd like you to do this with me today. So go ahead and get your phone to jot down some numbers or a pen and a piece of paper, and we'll do this together. This is a risk calculator for diabetes. And what I'd like you to do is add up your points on the following risk factors to determine if you are at risk for type 2 diabetes. And as you can see, this is data from the American Diabetes Association. Every 21 seconds, someone new is diagnosed with type 2 diabetes. So how old are you? Less than 40, 0 points, 40 to 49, 1 point, 50 to 59, 2 points, greater than 60, 3 points. So you don't have to tell anyone, but go ahead and write your number down. Are you male or female? Do you have a mother, father, sister, or brother with type 2 diabetes? If yes, then you get 1 point. If no, no points. Have you been diagnosed with high blood pressure or hypertension? If yes, you get 1 point. Activity level. Are you moderately active? Do you exercise for at least 30 minutes per day on most days of the week? Sadly, I have to say no. I wish I had time. What is your weight? So you can see your height on the left side of the screen here. So I'm 5'4". And you get a point if you're in this column, 2 points if you're in this column, 3 points if you're in the final column. And if you're below this level, below this left column, you get 0 points. So I'll leave that up there for a second for you to find yourself based on your height and your weight. For women only, have you been diagnosed with gestational diabetes or had a baby that weighed more than 9 pounds at birth? If yes, you get 1 point. So how did you do? How did you score? If you scored 5 or higher, studies have shown you were at high risk for developing type 2 diabetes, and you should consider talking to your doctor about getting tested. The test requires a simple blood test. So how do we diagnose diabetes and prediabetes? So there's various ways to do it. Fasting sugar level or fasting plasma glucose is one of the most common levels. Normal would be having a fasting glucose below 100. A fasting glucose above 126 would be considered diabetes, and in between is prediabetes. A second way to diagnose diabetes and prediabetes is something called an oral glucose tolerance test, where you go to the laboratory fasting and they give you this sweet drink, which has a specified amount of sugar in it. And they measure your blood before and then 2 hours after to see how your body responds to sugar. A normal response would be to have a 2-hour sugar below 140. You meet criteria for diabetes if your 2-hour sugar is above 200. And in between is prediabetes. The third way to diagnose diabetes is a simple blood test called hemoglobin A1C. You do not need to be fasting for this test. Normal is a hemoglobin A1C below 5.7%. And once the level's above 6.5%, you have diabetes. In between is prediabetes. Now, we do recommend that any abnormality be repeated and confirmed on a separate day unless the levels are strikingly abnormal. And it's also important to mention that if you have symptoms of high blood sugars, meaning excess thirst, excess urination, and any blood sugar over 200, that also meets criteria for diabetes. Now, if you're found to have an abnormal result on one of these tests, say you're in this pre-diabetes range on one of these tests, it is recommended that this test should be repeated every 6 to 12 months to monitor for the development of type 2 diabetes. And if all results are normal, these should be repeated every 3 years in higher risk individuals. So this is a very colorful slide, but I like it because it really focuses on many important factors related to how to manage prediabetes and diabetes. It focuses on nutrition, physical activity, making sure you get enough sleep, and a recommendation of at least 7 hours per night. Screening for any mental health disorders. Is there any coexisting depression that's contributing to the higher weight? Is there any concern for binge eating or nocturnal eating? Those can have a behavioral health component that need to be addressed, perhaps with therapy. Making sure we counsel on quitting smoking, because smoking also increases your risk for all of these adverse health outcomes. So we'll talk more in depth about nutrition and physical activity, but I wanted to make sure that we talked about the importance of other things like sleep, behavioral health, and smoking cessation. So when it comes to treating patients that are found to have prediabetes, our goal is to get this A1C back to a normal level, below 5.7%. And within a 16-week time period, so that's roughly 4 months, the recommendation is to lose 7% of your body weight. There's also a recommendation to get at least 150 minutes of exercise per week. So if you break that down, that's about 30 minutes on 5 days of the week. And consider medications, especially when the hemoglobin A1C is really in the higher range above 6.2%. And the last thing I'll mention is weight loss surgery or gastric bypass surgery can be considered if you have prediabetes and have a body mass index above 40 or a body mass index above 35 if you have other health complications related to excess weight. And it is an effective strategy for reducing your risk of developing type 2 diabetes. So what is a reasonable target when you're trying to lose weight? So 1 to 2 pounds a week is a reasonable target for weight loss, with an ultimate goal of 7% loss of your body weight within that 4-month period. We talked about the 150 minutes per week of physical activity, and really working with someone to help you identify what dietary changes you can make. So we at Baystate have access to registered dietitians and nutritionists that can help with counseling on diet for patients with prediabetes or diabetes. I recognize that that's not an option for all patients, however, and there are free dietitians at many grocery stores that can help when you're selecting foods at the supermarket and can help you with reading food labels and identifying healthier options. So that's just another consideration. And so many of my patients come to me and say, so what is the diabetic diet I'm supposed to follow? Tell me what to eat. And the reality is there's no specific diet. And in many ways, I think that's probably the best way to go because we care for a lot of patients that have varied diets. You know, we have some patients that are vegetarians, some that have a higher rice and bean content to their meal, some that have different ethnic food choices. And we want everyone to be able to eat the types of foods that they enjoy, but in moderation, and to know what are some healthier food options to make when you have a choice. So there's no specific diet and there's no specific percentage of calories from carb versus fat versus protein. What we have found in many studies is that lower carbohydrate eating patterns do tend to benefit patients with diabetes and prediabetes, but there's no exact cutoff as to the maximum number of carbs you should eat. A general recommendation is no more than 26 to 45% of your total calories from carbohydrates. And a nutritionist can help you figure out what that means for your specific diet. So general guidelines: eat 3 meals per day, do not skip meals, and make sure your meals are no more than 5 to 6 hours apart. We find that patients who skip meals do tend to gain weight over time, and so really trying to make sure you have 3 meals a day is important. These are the things that can help keep you fuller longer and will help with your health goals long term. So trying to increase the fiber in your diet, recommendations for 30 grams a day or more is a good target. Trying to increase the whole grains in your diet. So anything that has grains or carbohydrates, try to aim for 50% with whole grains. Aim for multiple servings of fruits and vegetables per day, 5 to 7 servings per day. And drink plenty of water. So these things can help fill you up with healthy food choices. In general, we're trying to recommend a reduction in total calories, and for women, a general guideline is 1,200 to 1,500 calories. And for men, a general guideline is 1,500 to 1,800 calories, but recognizing that if you're very physically active, you probably need more than that. We do recommend that you reduce your dietary fat, avoid trans fats, and try to limit sugary beverages. So that includes all fruit juices, all regular sodas, and high sugar containing drinks like Gatorade, Kool-Aid, and try to stick with water and calorie-free beverages. When it comes to alcohol, the recommendation is to limit to 2 drinks per day for men and no more than 1 drink per day for women. As I mentioned, fiber fills you up and it also prevents your blood sugar from rising, so it is a great option. And you should try to aim for 30 grams per day. You will see that things like oatmeal, oats, beans have the highest fiber content. There are different cereals that have fiber and other foods that have fiber. Some whole grain breads also have fiber, along with some fruits and vegetables. In addition to helping control your weight, whole grains will reduce your risk of developing diabetes, can reduce your risk of heart disease and heart attacks, and reduce your risk of cancer. They've also shown to reduce your cholesterol and your blood pressure and improve your digestive health. What are some examples of whole grains? Things like whole wheat bread, oats or oatmeal, as I mentioned, quinoa, brown rice, red rice, purple rice, whole grain pasta, and popcorn. And they're really not that hard to find in your supermarket. These are just 3 things that I've seen in my supermarket, and they're not terribly expensive. Whole wheat bread, whole grain rice, and whole wheat tortillas. When you think about how you should fill your plate, some nutritionists recommend using smaller plates so that you don't have such a large option to fill up your plate. So I know that's a strategy some nutritionists use, but also being mindful of how to fill your plate. So you'll see this green section is the vegetable side. So trying to at least half your plate with non-starchy vegetables. So that includes all vegetables other than potato, sweet potato, corn, and peas. So any other vegetable in this green section. 1/4 of your plate should be your protein, and 1/4 of your plate should be your grain or your starchy foods, your carbohydrates. Here we have dairy, and here we have fruit. That's a general guideline as you're thinking about your meal plan and your plate, how it should look. Focusing a little bit on exercise. So we talked about that 150 minutes a week. There's a recommendation for no more than 2 consecutive days without activity, and adding 2 to 3 sessions of resistance exercise. So that includes things like weights. Prolonged sitting should be interrupted every 30 minutes. Actually, it's been 30 minutes. Why don't we actually take a minute, stand up, do a little stretch. So no more than 30 minutes of sitting. Not that long, is it? Some people actually have a reminder on their phones and their smartwatches to stand every 30 minutes. Not a bad idea. So in addition to weight loss and improving mental health, other benefits of exercise include increasing your insulin sensitivity, lowering your cholesterol, lowering your blood pressure, improving your blood sugar, reducing your risk of heart attacks, and preventing or delaying the onset of type 2 diabetes. So many of my patients ask, well, what can I do? I live in an area where it's not safe to be outside. What are my options? I don't really want to go to a gym, or I can't afford the gym. So to be honest, walking is a fine exercise. So if you can find a safe place to walk, whether it's in the mall, whether it's we have a beautiful park, Forest Park. There's many other parks in the area as well that are safe. Planet Fitness is reasonably affordable as well, and there's many of them in the area. The YMCA actually has different funding options depending on your level of income. So that might be an option for many people, and they have the resistance exercises there, the weights. And in the pandemic, many people have started doing these live streaming classes. So you can go just on YouTube or on different websites, and you can live stream a workout class at home. They have all sorts of free workout options that you can do right in your living room, as long as you have a smartphone or iPhone or tablet or some sort of device. It probably will not surprise you that they have seen significant weight gain during the COVID pandemic. And you'll see that this was actually only maybe 5 months into the pandemic. So it was an online survey in August of 2020 of 3,400 adults. And 42% admitted that they gained more weight than they intended over the past 12 months. And on average, they reported gaining 29 pounds during those 4 or 5 months of the pandemic. 10% of respondents reported gaining more than 50 pounds. And when asked further questions about where the weight came from, most patients reported eating more junk food, less activity, more anxiety, and less sleep. And so we have seen in our practice and in the hospital dramatic rises in patients with diabetes and prediabetes since the pandemic has started. When it comes to alternative options for managing prediabetes, the main medication that we consider for managing prediabetes is a medication called Metformin. Metformin has been around many years, and it is a common treatment for both prediabetes and early type 2 diabetes when used in addition to diet and exercise. The most common dose is 2,000 milligrams per day or 1,000 milligrams twice a day. And we especially recommend considering this medication if a patient has prediabetes and they have a body mass index above 35. This is something you could calculate on your smartphone or on your computer. If you put in your height and your weight, you can calculate your BMI. If you have a prior history of gestational diabetes, and if you have an elevated fasting glucose greater than 100. These patients tend to benefit the most from Metformin. Now, how does Metformin work? Well, it does help lower your blood sugar, your blood glucose, but it does not cause low blood sugar. And so the way that it works is it decreases the amount of glucose that your liver produces, and it improves your insulin resistance. So what happens is that your muscles can use the glucose for energy more effectively, and that leaves less sugar or less glucose in your bloodstream. And that's how it ends up lowering the blood glucose level. But it does not cause an abnormally low blood sugar, it just keeps it in a stable range. So take-home points for today. 1 in 10 Americans have diabetes already, and 1 in 3 have prediabetes. Most people with prediabetes are not aware that they have it. Without lifestyle interventions, we know that these patients with prediabetes, up to 70% of them will develop type 2 diabetes during their lifetime. We also know that if you can intervene with lifestyle changes, primarily making some changes to the diet, increasing the physical activity level, you can dramatically reduce your risk of developing type 2 diabetes. There is also a medication that can be considered in select patients called Metformin that can be used in addition to diet and exercise. So that was the main content I was hoping to share with you today. I'm just going to stop sharing. And we did leave some time for questions and answers. I believe we were going to have patients put their questions in the Q&A box, and we can review those all today.
Great presentation. Thank you. Great information. And I loved your exercise break. I did get up and move around a bit. So I appreciate that. It's a good reminder. Amanda does have a question in here, and it looks like there's more coming in. She asks, why would you use one diagnostic method versus another for prediabetes?
So that's a great question. We have 3 different ways to test for diabetes. 2 of them require a fasting blood test. And so that can be a barrier for some patients who find it difficult to get to the lab first thing in the morning, who may not have transportation. It certainly is more convenient to do, let's say, a laboratory hemoglobin A1C level, which does not have to be done fasting while the patient is in the office, because you can do it right then and there. I will say that some offices even have that test as a finger prick test that they can do in the office. So you may have the information right away in your doctor's office. So for those reasons, I would say hemoglobin A1C is more convenient. It will miss some patients with early diabetes, however. And so if you have a high level of suspicion, or if you're doing a fasting blood test anyway, say to check someone's cholesterol, it's definitely easier to do a fasting blood sugar level, a fasting glucose test.
Great, thank you for that. The next question, where are the most common hidden sugars in diet found?
So we didn't talk too much about reading food labels, but it is something that's worthwhile if you can start to pick up the foods that you're eating and looking at the food labels. And what you will find is that the serving suggestions sometimes are quite small, quite a bit smaller than what you would typically consume. For example, if you look at a cereal box, the serving size may be a half a cup of cereal. And when I ask my patients, how much cereal do you eat? You know, it's maybe like this, which is 2 or 3 cups. And so it can be deceiving. So I would just encourage you to look at the serving size when you're reading food labels. And when it comes to hidden sugars, I guess that's a difficult question. Fruits do contain sugar, but in general, there's so many health benefits that we don't recommend limiting them for patients with diabetes or prediabetes. Certainly the high calorie foods and the high fat foods like the donuts, the pastries, sweets, potato chips, fried foods have high amounts of fat and high amounts of carbs. Those are the foods that tend to really impact your blood sugar and contribute to weight gain over time.
Great, thank you for that. We all have questions about our diet.
That's
right?
Great.
Yeah. Next question then. Are diet changes alone enough to prevent the transition to diabetes?
So we hope that diet and exercise together dramatically reduce your risk. You might notice in the beginning, I said it reduces your risk in half, however. That's probably partially related to the difficulty in sustaining those lifestyle changes over a lifetime, and also to the natural history, because we know that over time, insulin resistance worsens and the pancreas's ability to make insulin declines. And so unless you're able to sustain those lifestyle changes, you may need to sort of up the level and consider adding a medication like metformin. There are also other competing factors. So other medications can cause higher blood sugars. Steroids is a common one. Some mental health medications for mood disorder can cause high blood sugars. So there's other medications that can also contribute.
Thank you for that. Why did being over 60 add extra points to that questionnaire?
So we know that weight and age are the two highest risk factors for diabetes. As we age, the pancreas just burns out, if you will, if you are someone who has risk factors. So if you're a little bit overweight, as you age, the risk for diabetes goes up dramatically.
Kay Chan would like to know if medication is effective in lowering blood sugar level, can one then get off pre-diabetes medication, just rely on exercise and diet?
So that is also a good question. It's a difficult question to answer. If someone is able to make significant lifestyle changes and able to lose weight and keep up with their exercise habits, it's something you could talk to your doctor about. If your blood tests improve such that you're no longer in the pre-diabetes category, you never know if you're no longer in the prediabetes category because of your lifestyle changes, because of the medication, or because of the two together. But you certainly could talk to your doctor about the possibility of slowly lowering the dose of the medication to see how your body responds. As long as you continue to monitor with follow-up lab work every 3 to 6 months to see how you're doing, I think that's very reasonable.
Thank you for that. Kay Chan would also like to know, is Adavastin appropriate for treatment of prediabetes? And I hope I'm saying that right.
That's okay. I believe, is it atorvastatin?
Oh, yes, that makes more sense.
Yeah,
Thank you.
right. So atorvastatin is a medication that we typically think of for lowering cholesterol. The other name is Lipitor. It's extremely effective at lowering cholesterol, preventing heart attacks, peripheral vascular disease, but it's not a common treatment for type 2 diabetes. Some studies have shown statin medications might actually raise your blood sugar levels slightly. Very minimal amount, maybe 2 to 3 points, but statins may actually raise your blood sugar level a small amount rather than lower them.
Interesting. Thank you for that. Amanda would like to know, is there anything you can do to strengthen, in quotes, your pancreas?
To strengthen your pancreas. I love it. How do we strengthen our pancreas? So certainly eating a healthy diet full of fiber and whole grains helps prevent your blood sugar from rising after meals. Certainly exercising and keeping your weight at a healthy weight helps your pancreas function optimally. Beyond that, if you're someone who has already developed prediabetes or diabetes, there are some medications that we use to prevent the pancreas from losing its function, if you will. So there's a class of injectable medicines called GLP-1 agonists that can be used strictly for patients with obesity that can help with weight loss, but has also been shown in diabetes studies to preserve pancreatic function, preserve the beta cell function.
Excellent. Wow, that's good to know. Thank you. Kay Chan would like to know, is type 2 diabetes reversible?
So reversible, I will say, is a word that endocrinologists don't often use. Remission is more the word that we're most comfortable with because we know that diabetes is progressive. And as you age, and if there's any weight gain, diabetes does worsen. And so if you're able to lose weight and exercise and improve your diet and come off all medications and stay with normal glucose levels or normal hemoglobin A1C levels, we would use the term diabetes in remission, but continue monitoring periodically, probably every 6 to 12 months in the beginning to make sure that things are in a safe range. Similarly, many patients who are overweight or struggle with obesity may go on to pursue weight loss surgery, gastric bypass surgery, and they may have had diabetes before their surgery, but no longer have diabetes after their surgery. That's one of the main benefits. But we would still use the term diabetes in remission.
Very good. Laurel would like to know, how soon after waking up should a pre-diabetic check one's fasting sugar?
So if you have been recommended to monitor your blood sugars, we generally recommend checking it first thing when you wake up. And the reason is after you stand up, walk around for 20 minutes, walk out and get the newspaper, maybe turn on the TV, there are some hormones that are released in your body, cortisol and growth hormone. Both of those hormones do raise the blood sugar. So first thing, as soon as you wake up would be the best time to check. I should also mention, we talked about the importance of eating 3 meals per day. Many nutritionists recommend eating breakfast within 1 hour of waking up, making sure that you have something in your system within 1 hour. Because many of my patients do tend to maybe wait 3 or 4 hours till lunchtime, and that's not healthy long term.
Thank you for that. I actually have a question. I see a lot of commercials for diabetic medicines and these things that are put on your arm now to check your numbers, and so to speak. How effective some of those things we basically have been advertised to us about diabetic medications and things?
So I believe the one you're referring to, it looks like a little circle on the back of your arm.
Right.
So that's called a Freestyle Libre continuous glucose monitor, or CGM for short. And it is approved for use in patients with diabetes, not for prediabetes. And most insurances will only cover it if you're on insulin. Medicare requires for you to be on insulin 4 injections per day. So it is a great option for monitoring your blood sugar levels, but it's mostly reserved for patients with diabetes, mostly reserved for patients who are on insulin. But it is an amazing, amazing tool for those patients. As you can imagine, it's tough to prick your finger 4 times a day, and some of my patients with type 1 diabetes even do it 10 or 12 times a day. So it really has been a really nice technological advance for those patients. In terms of I'm also wondering if you're referring to the medications that you see that are advertised. There's a lot of oral medications, some injectable medications that you see on television. Many of those medications are excellent and they're great for select patients. Most of those are for patients with established type 2 diabetes, not so much for pre-diabetes. But not everyone is eligible and they're not right for everybody. So it's something you should talk to your doctor about.
Mm-hmm. Well, very good. I actually thought that was something for somebody with pre-diabetes. So that's good information.
Mm-hmm.
So Kay Chan is asking, controlling sugar consumption is very difficult. Do you have coping strategies on reducing intake?
So it is very difficult. I will tell you, our dietitians are amazing. They have all of these tips and tricks. And so I would say if you haven't tried it, working with a dietitian, you might give it a try. We have dietitians through Baystate Endocrinology. And as I mentioned, there's some private dietitians in the area, and many grocery stores have free dietitians who are available to meet with you. Sometimes they even pop up on my computer screen so you can ask questions in the chat box to a dietitian. For example, I have some patients that say, you know what, doc, I eat out twice a day and I'm not going to stop it. It's not going to happen. And so we work around that and we figure out, well, you know, what foods within that menu have lower calories and how can they make that menu, you know, safer for them. Maybe it's removing the bun. Maybe it's taking the cheese off. Maybe it's cutting it in half and saving the other half for later. So strategies like that. Dietitians really are amazing for coming up with tips and tricks around that. And the other thing I'll say is some foods aren't terribly filling, and so you're hungry again in 2 hours, maybe 3 hours, maybe. And so trying to find the foods that fill you up, that tends to be protein, fiber, and whole grains. Those are the 3 types of foods that you could try to focus on that tend to fill you up for longer. They also prevent your blood sugar from rising. So trying to find those and find ways to get them into your diet.
Excellent. No, those are great suggestions. And you're right. I've met many of the dietitians at Baystate, and they really are terrific. And they learn some great strategies.
Yeah.
And honestly, everything feels like it has sugar in it. So I feel Kay Chan's pain. I don't see any other questions coming up. Oh, wait a minute. We do have another one. Do you have, Amanda, do you have an eat this, not that kind of chart that you use?
Yes, so there are tons of eat this, not that, all over the internet, to be honest. And you can look on the American Diabetes Association website. They have a whole section on nutrition, which gives you some guidance. And there, you can also Google eat this, not that. There's a lot of examples with pictures, which are nice. I don't have a specific reference for you other than checking out the American Diabetes Association website. They also have some great recipes if you're someone who likes to cook and try new recipes. But you get a feel for the types of foods that are good for patients with diabetes and prediabetes by scanning through some of the recipes. And I will say that we do expect you to have carbohydrates. We expect you to have carbohydrates at every meal. It's just a matter of portion sizing and trying to boost some of the other things like fiber, whole grains, fruits and vegetables, and protein best you can.
Excellent. Thank you for that. It looks like we're at the end of our questions. Oh, nope. Just when I think we're done, we have another one pop up, which is great. People are clearly interested. Should you just eat like you have diabetes, even if you don't, if you have pre-diabetes?
I would say a resounding yes, absolutely. Because it's a continuum, and patients with prediabetes, as we talked a lot about today, have a high risk of developing diabetes. And so I even am looking up healthy recipes on the American Diabetes website, and I don't have diabetes in my family. They just have healthy recipes. They're also good for heart health, for longevity, for preventing diabetes. So in general, I think it's a great idea to sort of think as if you have diabetes and gravitate towards those types of menus and recipes as if you had diabetes.
That's great to know, and great information. I think I'm going to try that too. Kate Chan says, thank you so much, and that it's been an excellent presentation, and I concur. Thank you, Dr. Gordner, for your time today, and we so appreciate you and you're sharing your time and expertise.
Oh gosh, it was my pleasure. That was so much fun.
Wonderful.
It really was.
Thank you.